Problems, worries, sadness. Are you seeking solutions?
Bible says,
Do not be anxious about anything. Instead, pray about everything. Choose faith over fear.
Welcome to Vital Signs, your prescription for a healthy family, where members of the Catholic Medical Association explore topics vital to the health of you and your family members. I'm Dr. Tom McGovern, the host of Vital Signs, brought to you by Shalom World TV. Today we explore the most common cancers that affect people around the world. Worldwide, 1 out of every 2 men and 1 out of every 3 women will develop cancer. The most common is lung cancer, with over 2 million cases a year, followed closely by breast cancer, affecting about 2 million women. Number 3 is cancer of the colon or large intestine, with over 1.8 million people affected annually. In 4th place is prostate cancer, which affects about 1.3 million men worldwide. And in 5th place is stomach cancer, with just over 1 million cases annually. There is hope to reduce these numbers because there's a strong association between these cancers and certain behaviors that we can reduce or stop, such as cigarette smoking or consumption of fatty foods and large amounts of red meat, as well as a great consumption of alcohol or too much food leading to obesity and not getting enough exercise. But now it's time to learn how we can reduce our risk and increase the chance of successful treatment of cancer in our lives and those of our family members. Joining us today is Dr. Felix Rodriguez, a medical oncologist who's treated cancer patients for over 20 years in and near Boynton Beach, Florida. Today, he'll be giving us advice on avoiding or finding early the most common internal cancers. Please note that the figures I quote in questions are based on worldwide numbers, which may differ from cancer rates in your country. Felix, welcome to Vital Signs.
Thank you, Tom, for having me again on Vital Signs.
Felix, the most common cancer in men and 3rd most common cancer in women and the most common cancer causing death is lung cancer. And the main cause of this is clear. It's smoking. About 1 in 5 adults worldwide smoke tobacco. Felix, what have you learned about lung cancer that you wish more people knew?
So as you mentioned, the main risk factor is smoking. And even though the rates of smoking in our country, the United States, have been dropping, I know in the rest of the world, it's still a very common, fortunate situation. So if this is a preventable cancer, then what we need to do is not smoke. So I want to make sure I always say that message anywhere I go.
Now, Felix, the most hardest addiction to kick, supposedly, is tobacco smoking. What advice do you have for those people? And there's large numbers of them. I've heard that up to 3/4 of smokers want to quit but can't. What advice do you have for them?
If they already have a primary care physician and they're worried about their risk for lung cancer, they should be talking to them about how to quit. As you said, it's not easy. It's not easy. When I'm talking to patients, many of them, surprisingly so, their rates of success, and I don't know what the statistics say, is better when they do this cold turkey. It's very hard. But if they are able to accomplish it, then the important thing is so that they do not resume it. Then there are other techniques to do, and I'm sure it varies country by country. The other thing, and this is not something that we talk in the United States anymore because of all the regulations that we've had, but if you're in a particular country that still doesn't have very strict laws for tobacco, and if you're able to impact the legislation process, that's something that it would be important for people far and wide to get involved in. For the individual patients, the first thing that they need to do is to at least come up with the purpose, as with any lifestyle change, the purpose of quitting.
Felix, among women, the most common cancer affects the breast. Why is the breast such a common location for cancer in women?
Well, there are risk factors involved in that, but the breast tissue is a tissue that when you are a teenager starts developing. We use the word proliferation, so the cells are growing. And throughout the life of a woman, the reproductive life of a woman, those breasts have a lot of stimulation from hormones. And now, and I don't know how common oral contraceptives are throughout the world, but at least here in the United States, oral contraceptives are things that are very commonly used. And so that does raise the risk. And that is something that will carry on through the rest of the woman's life. I would say that the other reason why we see this commonly is the population is aging. And so the older you get, the more likely you are to develop cancer, and breast cancer being one of those diagnoses.
And if a woman has breast cancer, it's best to find it early when it's small. How does she find it early so it doesn't get too big?
The mammogram. So we have this imaging study that most people already know called the mammogram. So it's an X-ray, it's a specialized X-ray of the breast tissue. And over the years, the technology to find earlier cancers has gotten better with computerized technology. We're now even doing MRIs of the breast. So most of the time, these cancers are found by imaging. Of course, there will be cancers that will not necessarily be found that way. So it's important that women do their own self-breast exam. I tell my patients that they need to do a self-breast exam at least once a month. They can select the date of their birthday, for instance. So if their birthday happens to be on the 30th of the month, then always be doing their breast exam on the 30th of the month. And that the purpose of that is to find if there's been a difference. Then they say, whoa, I didn't have this last month. The other thing is that they keep up with their appointments with their primary care physicians or their gynecologists so that these breast imaging studies are done appropriately once a year.
It sounds like the self-exam has probably been the best behavioral change a woman can make to find it early. Are there any behavior changes she can make to reduce the risk of getting it in the first place?
So there are other risk factors that we haven't mentioned. I talked about the oral contraceptive pill. There are other factors. For instance, if there is a family history, then that lady needs to be aware that they need to pay closer attention to the screening. The other thing, obesity and lack of exercise. It's been clear for many other cancers, not only breast, that if you can reduce your obesity, if you can exercise, that will indeed reduce the risk of breast cancer. The other thing, in women that have many children, that tends to reduce the risk, surprisingly so. It's not a logical conclusion for people that are not in medicine, but the ladies that have had no children have a higher risk than ladies that have had children, and ladies that have a small number of children are at a higher risk than ladies with more children. So that be fruitful and multiply from Genesis does more than just populate the earth. It also reduces the risk of breast cancer.
Another benefit of large families.
Yes.
Well, let's move a little lower than the breast down to the large intestine, the colon and the rectum. That's the site of the second most common cancer in women and the third most common in men. What are risk factors for cancer of the colon?
Family history is very important, and there are lifestyle changes as well. In the Western countries, we have a higher incidence than in the Eastern countries, and it has a lot to do with diet. As I mentioned, for breast cancer, obesity is also an important risk factor there. And as far as the diet, well, we often hear about the typical barbecued and burnt meat, having your meat overcooked. That tends to raise the risk. And as far as the family history, we are seeing that time and again. There are family syndromes. And so if there is a family history that you know of, you better start getting screened. And there are other conditions such as inflammatory bowel disease, which is a condition of the gut that raise your chances. So those are things to be aware of when trying to reduce the risk of colon cancer.
What is it about the meat? Is it something that happens by the barbecuing where other methods of cooking the meat would be healthier?
By doing the barbecuing and the burning of the meat, you are already generating carcinogens, which are chemical substances that when they come in contact with your gut, they will stimulate the development of cancer.
Felix, what are the first signs that somebody might have colon cancer and should see a doctor?
One of the most common signs is bleeding. So if you see that when you are going to the bathroom, moving your bowels, you're having bright red blood or something in the same category, you better pay attention to it. Then there are patients that experience changes in their bowel habits. For instance, it can be something, well, I was never constipated and now I'm constipated. Or, for instance, I was never having pain when I moved my bowels. Now I'm having them. So those are signs that something could be going on and that you need to seek medical attention.
Felix, the second most common cancer among men is prostate cancer. What makes it so common?
So we are having a higher incidence of prostate cancer nowadays because we're screening more. So the older you are as a man, the higher the chances that you will be discovered with prostate cancer. So that's one thing. And another thing, and I hate to keep mentioning this over and over, but men who are overweight tend to have a higher incidence of prostate cancer. So those will be things to pay attention to. The other thing, and this is something that I don't know how common it would be throughout the world, but here in the United States, we are prescribing hormones for patients because they have what we call hypogonadism. They have lost or they have lower testosterone levels. So if those patients are being given testosterone by their primary doctors, well, I'm sure those primary doctors are going to be screening them more for prostate cancer because testosterone, being the male hormone, is the main stimulus for these cancer cells to grow.
Felix, I remember hearing that if you do autopsies on men who die after 70 or 80 years old, a huge percentage of them have microscopic prostate cancer. Is that true?
That is correct. That is correct. And that's why I mentioned that the more we screen men, the higher the chance that we will discover these prostate cancers. Actually, in the screening literature for cancer, both in the medical oncology and mainly the urologic literature, there are all these equations and calculations that we have now available to try to figure out which patient would benefit from a prostate biopsy. And if we do a prostate biopsy, when do we take care of the cancer? And they're now available online. There's been a lot of studies, at least here in the United States, to try to figure out who to be aggressive with. Now, a word of advice: if you are found with issues with your prostate when you are a younger man, in your 50s, or even the 60s, I would say, that means closer attention needs to be paid because those cancers could behave more aggressively. But even now, for the younger patients, the data for when to be aggressive is being studied.
You've mentioned now for three cancers that obesity is a risk factor. What is it about being overweight that makes it more likely to get cancer?
All the physiology behind it is not clearly understood, but in many cases, the hormonal changes that happen may be causing the higher incidence of cancer. Cancer cells are very, I should say, sensitive to all the chemicals that are bathing them. We have so many chemicals circulating in our bloodstream. And so these cancer cells, it's very easy for them to be stimulated by one chemical or the other. And And the higher weight tends to correlate with the incidence of that. And the other thing is we know a lot more about the inflammatory problems. So there are these conditions that cause your body to have more of these chemicals that have to do when you're inflamed. And for the listeners who don't know what the word inflammation means, you may know that when you hit your skin, your skin gets red. Well, that's a sign of inflammation. Well, that can happen within your body. And those inflammatory chemicals are responsible for a lot of these derangements in the physiology and the processes of the cells that can then have them become cancer.
You've mentioned cancer screening, and it seems like groups are changing their recommendations every year, like the U.S. Preventive Services Task Force. So, as of today, what screening exams do you recommend for adults to find cancer early?
So, if you're a woman, definitely the mammogram. There are now recommendations for women over 40, and currently they're evaluating what to do with the younger than 40 crowd. The problem with those ladies is that their breasts are still very young and the images may not be good. But so the mammogram is important. Many ladies will know about the PAP exam, so the cervical exam for cervical cancer. That's when they go to the gynecologist. And when it comes to colon cancer, there typically we do this evaluation of stool for occult blood to see if there's any hidden blood in the stool. And then the colonoscopies. Currently, colonoscopies are recommended beginning at age 50. If there is a family history, we should start much younger. And for Latinos and for Black patients, we sometimes recommend that they start with their colonoscopies at age 40. There was recently that celebrity, the actor who died. I don't think he was quite 40, but I'm sure he had a family history. So that it's important that once we reach a certain age that we are participating of those screening guidelines. And I also mentioned the PSA. Usually the primary care physicians, I know my primary care physician started checking my PSA the minute I started being his patient when I was in my 40s. So in order to prevent these cancers, your best person, your best ally is your primary care physician.
Felix, we've talked about behaviors such as overeating and smoking. What other behaviors might help reduce people's risk of cancer? You know, it's not very fascinating to talk about diet and exercise, but they make a difference, don't they?
They do. They do. And then the other thing that I have not mentioned yet is alcohol consumption. There are people that have, unfortunately, the condition of alcoholism. They're prone to a series of cancers, including cancers of the head and neck and cancers of the stomach. So if a certain person would have that problem in their health, it's important they start also looking into some kind of treatment to stop drinking.
And what is it about exercise that's helpful? Is it just related to preventing obesity, or is there more to it than that?
So it's well known that exercise changes your body quite a bit. One personal example, when I started seeing my primary care physician, that's one of the first things that he told me that I needed to do. So exercise, it's not only that inflammatory problem that I told you with obesity, your whole physiology is able to immunologically protect you to some degree. To protect you against the development of these cancer cells, because our bodies have a way of monitoring for rogue cells. So these cells look different to the immune system of the body. So if your immune system is under better condition, your body will be more suitable to try to nip the cancer at the bud. One thing that I also want to mention that you haven't asked me about is vitamin D. I know during COVID, we've been talking a lot about vitamin D. Well, it also helps in cancer prevention. I know that has nothing to do with exercise, but it has to do with ways to prevent it.
One international cancer of interest is stomach cancer. It's number 5 worldwide. It's low on the list in the US, but it's number 1 in several East Asian countries. Why is that?
There are factors that have to do with diet and certain spices that are used, certain ways of cooking food generate a substance called nitrites, and those chemicals tend to stimulate the stomach lining to become inflamed, even though patients may not necessarily have symptoms of the inflammation that is in their stomach, and then that can lead to stomach cancer. Now, one thing that I learned in med school, and I'm sure it's still being taught far and wide, is that when patients from Asian countries move to the West, so be it to Western Europe or the United States, they tend to lose the risk for gastric cancer, and they earn or gain the risk for colon cancer. So they're in the diet issue.
And Felix, what would be the best source of information for people who want to learn more about cancer?
In the United States, we have the American Cancer Society. They are an organization that publishes quite a bit of information for the general public. The other society here in the United States is the American Society of Clinical Oncology. They're the organization that where all the medical oncologists belong, and they publish quite a bit of information. Through the World Health Organization, and I haven't checked their website recently for cancer, but there are websites that can have a lot of information. The European Society of Medical Oncology, ESMO, they also publish a lot of information. I'm not sure in which languages, but I'm sure probably for sure in English, French, Spanish. So if somebody's looking into more information on that, I'm sure they can go online and look for those. So American Cancer Society, American Society of Clinical Oncology, and the European Medical Society for Oncology.
Felix, thanks for taking the time to inform us about these common cancers. For me, the main take-home point is eat healthy, live healthy, and get screened when it's time.
That's right.
Thanks for watching this episode of Vital Signs, your prescription for a healthy family, brought to you by Shalom World TV and the Catholic Medical Association, where we are inspiring physicians to imitate Jesus Christ. Please join us for our next episode and share the good news of Vital Signs with a friend, and may God bless you. I encourage everyone to send us emails with questions that you want to ask medical experts. Please email us at vitalsigns@shalomworld.org. Your questions and comments will help us determine what topics we'll cover in the next season of Vital Signs.
To all of the viewers of Shalom TV throughout the world, I want to encourage you not only to support this amazing media apostolate, but to spread the word to others. We all know how the internet and mass media are polluting the world with the poison of pornography and so much other forms of materialism. This is the source of eternal life, the gospel, and Shalom TV is consecrated to spreading the word of Christ. Thank you.